Hi, my name is Rod Snope. I'm with Nevro. Your physician recommended a trial of HF10 because you have chronic pain that's interfering with your life. It's impacting you severely. You've tried other things, epidural steroid injections, medications, you name it. Your doctor also believes you have neuropathic pain, which is conducive to this therapy. If you choose to do a temporary trial of HF10, myself and my team will be with you throughout the entire process. We'll do everything in our power to achieve the best possible outcome. In this video, what I want to do is first cover pain, how the pain signals are transmitted to the brain, and how HF10, the therapy, interrupts those pain signals or scrambles them to produce relief. We're also going to address which painful conditions work best for HF10, which don't work as well. We're also going to look into the preparation involved before you actually proceed with the trial. Look at the trial procedure, how it works itself, the implant procedure, and then the follow-up required to get optimal pain relief. We'll also address any commonly asked questions. So what is pain? Pain is the way the brain interprets sensory information. Pain can be caused by an injury, an infection, an ongoing ailment, irritation, ongoing over time. This information is then sent via nerves to the brain itself. How each individual patient interprets the pain is individual. Everybody experiences pain in a different way. Pain is multidimensional. It affects you physically, emotionally, mentally. It's all encompassing. Pain has two primary generators. One could be from the nervous system itself, or two, it could be from the musculoskeletal system, which includes the joints, the bones, the muscles, the soft tissues. Pain can also be categorized as acute or chronic. Acute pain, it typically resolves within 3 months or so. Long-term chronic pain lasts several months, is refractory or resistant to change despite your best coping efforts and less invasive medical treatments. How does HF10 work? Well, we know that pain signals are transmitted via the nerves. So as early as the 1960s, they started looking, how can we interrupt or scramble those pain signals along those nerves? And that's where spinal cord stimulation started to become a real therapy. So how it works is mild electrical pulses are applied to the sensing pathways of the spinal cord to interrupt those pain signals. There's two basic forms of spinal cord stimulation. Traditional spinal cord stimulation has been around since the origination of the therapy. This therapy involves the generation of abnormal tingling sensations when the electricity is applied to the spinal cord. Some people like these sensations. They're like, oh, this feels great, like an internal massage. But most patients find the sensation to be an unwanted side effect in most cases. It requires you to turn the stimulator up and down for different body positions to avoid surges. You have to avoid driving with the stimulation on. You may have to turn it off or down when you sleep. All spinal cord stimulators are classified as traditional except Nevro. Nevro is the exclusive manufacturer of HF10 therapy. HF10 therapy is the only spinal cord stimulator that does not produce these abnormal tingling sensations whatsoever. HF10 uses proprietary 10,000 hertz. Traditional spinal cord stimulators go to a maximum of 1,500 hertz or cycles per minute. This therapy runs at 10,000 hertz. Therefore, you do not feel the stimulation. And because this therapy is so unique to traditional spinal cord stimulation, the FDA required and monitored a head-to-head study versus traditional spinal cord stimulation, in which the therapies were directly compared over a 2-year period of time. The results of this study, when reviewed by the FDA Medicare, resulted in a whole new category designated just for HF10 because the results were so dramatic. Patients had better back pain relief, leg pain relief, their function was enhanced. And therefore, HF10 is now labeled by the FDA as superior traditional spinal cord stimulation. Not only does HF10 provide superior pain relief, it also allows you more freedom, less burden. You can use the therapy 24 hours a day, 7 days a week. You can use it when you drive, you can use it when you sleep. Your remote control is hardly touched once the therapy is optimized. A lot of patients just leave it in their glove compartment and never touch it once it's going. The device is a rechargeable device. So this device will last 10 years with simple, predictable 30 minutes a day of recharging. There's no abnormal sensations to concern yourself about. You can concern yourself about getting your life back in order, achieving the life activity goals that you're looking for. What does HF10 work best on? HF10 works best on pain that emanates or originates from the nervous system. It could be an injury, an infection, ongoing irritation to the nervous system itself. What HF10 does not work well on is acute pain. If you stub your toe, you cut your finger on accident, you want to know there's something I need to be aware of and avoid further problems. You put your hand on a hot stove, you remove it, and that's a good thing. HF10 does not interact with the acute pain sensing mechanisms whatsoever. It also does not work well on musculoskeletal pain. Musculoskeletal pain can originate from the bones, soft tissues, muscles. Examples of musculoskeletal pain could be your SI joints, arthritis throughout your body. It could be fibromyalgia. These are common scenarios where HF10 typically does not produce a robust response. There's also something called mechanical pain. Mechanical pain is kind of a mixture between acute pain and chronic pain. So it's commonly seen with disease states such as stenosis, where there's a narrowing of the spinal canal and you're going to get pressure on the nerves themselves. There's a chronic component with that, and HF10 works fantastic. However, if there's acute pinching of the nerve, that becomes acute, and HF10 may not be able to overcome that. We don't know until you try the therapy. It's like a diagnostic test to find out how much nerve pain you have when you do a spinal cord stimulator trial with HF10. So what do you need to prepare for? The first thing is you have to have a psychological evaluation. It's required by all insurances. You also need to potentially get imaging of your spine to make sure that your spine has enough area to place the temporary electrodes. You also will get approved by your insurance company. So we send all the information into them. We get an approval back before we would proceed. You would also get a cost estimate to ensure that this is going to be financially viable for you, but most of the time it works out just fine, but you will know ahead of time before you proceed. As part of the preparation process, you will meet with your physician ahead of the trial. Any clearances required, any blood thinner protocols that need to be started will be initiated. And most importantly, the physician's going to sit down with you and talk about your life activity goals for this trial. Everybody's pain is unique to them, and how it affects their life is unique to them. So therefore, the whole goal of this trial is to address the life activity goals that you want to see met. We want to look at what is pain stopping you from doing now. It could be as simple as walking, sitting, standing. Other more important things perhaps are your interactions with family, your work, hobbies, things you want to do that you can't do now. We want you to have a better life, so we establish these ahead of time. And we sit down and really put them as your goals, and then we seek to try to achieve them. In general, we want to see at least a 50% pain reduction in the affected areas and an achievement of these goals. If there's any doubt whatsoever about whether the therapy is going to make your life better, then we recommend that you don't proceed. But you will know, and that's a great aspect of this therapy that doesn't happen with spine surgery and other surgeries where you kind of hope that's going to work and you quite don't know. You're going to know whether the stimulator is going to be a life-changing experience for you or not. The life activity goals never really end. Unfortunately, many painful conditions are degenerative. They change over time. We want you to meet your goals, so they want to follow up with you at least annually to ensure that we're still meeting those goals. There may be different kinds of pain generators. Maybe it's more from the bones, maybe it's more from the muscles, and it can be augmented. It's not just a stimulator forever. If you need something else, your physician can apply it and go after those pain generators and keep you on track for your life activity goals that have been established. The HF10 trial is a test run. You can try it before you buy it. The Stimulator trial is very similar to an epidural steroid injection you probably received in the past. So an epidural needle is placed into the spine. It's a thin, flexible catheter they call a lead. It's very much like a wet noodle. So what happens is the needle goes in, instead of putting the medication in, now the physician takes one of these catheters and slides it up through the needle up into the epidural space to the locations desired. So now the needles have been removed, the leads are in position, we confirm them with x-ray. They exit the skin, and what happens is they're placed in a temporary stimulator. This is taped down to your skin and your back, and then you will have a remote control which can be adjusted to optimize your therapy over time. You will be sore where the physician put the two needles in. It's a different kind of pain than you're typically used to. After the numbing medication wears off, patients tell me on average it takes 1 to 2 days for the initial soreness to get better. It's always going to be an irritant during the trial, but we really want to try to put that to the side and focus on what's important. How your pain's doing, and if you can do more things that we've identified ahead of time, and whether your life's going to get better. Because these catheters or leads are very flexible and thin, we don't want them to move once they're in position. So we want you to take it easy on the bendy, twisty, lifting actions, especially the heavy, torquey, weight-bearing motions. This is only because we don't want them to move. If we get towards the end of the trial, you want to see what this thing really can do, we can take the restrictions off, because these catheters are going to come out irregardless at 7 days. Other things that you want to be cognizant of is we've got to keep the bandage on the back clean and dry. The last thing you want, and the biggest complication of the trial, would be an infection. So make sure you don't take any showers, follow your doctor's instructions. Talk to your doctor. Typically, patients want to stay on their medications during the trial and not alter them, because you probably wouldn't be having the trial if you didn't have pain on top of the medications. So we don't want to introduce a lot of different variables. Again, this is a decision between you and your physician. You want to follow the directions. Myself or one of the Nevro technicians are going to be calling you every single day, perhaps 2 or 3 times, whatever it takes. One of the greatest things about this therapy is you take it home and try it in real life, in your own house, your own environment. How we make adjustments with this therapy is based on how you're doing. If you're doing well, why fix it if it's not broke? But if you need more improvement, we're happy to make those adjustments, and we walk you down the path every step of the way. We're with you during that process. HF10 is a unique therapy. It takes a minimum of 24 hours for the therapy to work because it has a ramp associated with it. It's kind of like if a doctor gives you a medication and says, your therapy is going to take a day or 2 to build up and start working. We keep track of these changes. The last thing we want to do is repeat something that didn't work. So you'll be reporting back to us and communicating with us and ensuring that we're moving forward with every step that we take. At the end of the trial, you'll go back to the office. It's not another procedure, it's very simple. They slide the catheters or leads out of your back, they take all the tape off, and then you make the decision. 9 out of 10 people will choose to continue on to the permanent implantation. But there's always 1 out of 10, or maybe 2 out of 10, that it doesn't work on. And so we want to make sure this is going to work for you before you go to permanent. If you choose to proceed, your doctor then will request for insurance approval. After that's attained, then you will be put on the schedule. Usually it takes 2 to 4 weeks before you get scheduled for the permanent implant. The implant procedure is very similar to the trial procedure. The procedure is done under complete anesthesia. So you'll be asleep, and during that time, the difference is they make an incision before they place the electrodes this time. They anchor the electrodes down, and then they make a second incision where a generator is placed. So the electrodes are placed in the generator. This generator is placed in a position that's not going to bother you. It's above or below the belt line, and your physician will mark that ahead of time, and you'll have input as to where it goes to ensure that it's a comfortable location for you. This procedure is an outpatient procedure done at a surgery center or an outpatient hospital setting, and you should go home typically the same day. Unique to the implant is the charging process. They've made this very simple. What happens is your battery is implanted in your back. You take this blue paddle, place it over the generator, press the start button, and then make sure it's recharging. It takes 30 to 45 minutes, and then you're done. What we don't want to do during this process is start the charging, because it does generate a little bit of warmth. So we want to start the therapy after your wound check appointment. So we want to get you healed up. We want to let you get through the first week or so, and at your post-op appointment, we bring in the charger, the remote control. We go through everything to make sure that you feel very comfortable with using it. And we're always available then to answer questions as you progress with the therapy. After the implant, the electrodes take 4 to 6 weeks in the epidural space to solidify. During that period of time, we want you to take it easy on the bendy, twisty, lifty motions. Follow your doctor's instructions. It's not as stringent as the trial because they are anchored down, but we don't want them to move. After 4 to 6 weeks, the leads have scarred down and they're going to stay where they're at. Then you can resume normal activities. In fact, we hope you do even more. And the sky's the limit at that point in time. We have people weightlifting, all kinds of things after it's all done, bowling, and you can get on with your life. Now that you have the implant, the electrodes that go in for the implant by nature are at a different spot in the trial. It's impossible to put them in the same position. So we start the optimization process over, which consists of location and amplitude. We need the right location and we need the right amplitude. So we have a dedicated HF10 coach that'll be assigned to you. This person is on the phone. Us technicians in the field, we're in surgeries, we're with patients all day. These people are dedicated to walking you through these changes to make sure we get to the right location, we get to the right amplitude. Be patient with the process. It takes a little bit of time to get where you need to go. Some it happens soon, others it may take a while. But the good news is once you get to the position where you're getting the best relief, it tends to stay put. It's durable, it lasts a long time. So you're putting the work in up front for the long-term benefit. This is in contrast to traditional spinal cord stimulators where you have to have the remote indefinitely, be able to turn it up and down every day. With HF10, once you get there, you're pretty much set. In terms of commonly asked questions, one of the biggest ones we always receive is, can I have an MRI? The answer is yes, you can have an MRI. You just have to go to a location that's been trained to do it safely. They turn the knobs to the correct settings, and they also ensure that there's no breaks in the system or there's other spinal cord stimulator components. Those are two things that would potentially prohibit you from having MRI, is a break in the system or having a non-Nevro device implanted. Those things are rare, but we want to make sure you're safe. But yes, you can have an MRI. Some patients wonder, will HF10 fix my problem? The answer is no. It doesn't correct the underlying issue generating the pain signals, but alternatively, it modulates those pain signals. So over time, you probably will have the device, assuming it works, forever, but it won't correct the underlying issue generating those pain signals. Is HF10 safe? Yes, it is. So when this high frequency stimulation is applied, it has no interference with your mental capabilities, your motor function, or acute pain sensing capabilities. It just modulates those pain signals traveling along the nerves to your brain. HF10 does not interact with pain medication. It doesn't require major surgery, so it is safe and you will feel normal. However, all surgical procedures do involve some risk. People ask me, can I take it out if I don't like it? Yes, you can take out. The trial leads are easily removed, and the implant itself, because it's just underneath the skin, it can be removed. It's non-destructive. When they're implanted, there's no alteration to your normal anatomy, so the device can be removed if you choose to do so. Can you turn HF10 off? Yes, it's very easy. You take the remote, slide off the back, press the red button. Can I take a flight or go through airport security? Yes. You will have an ID card issued to you. You bring that to the airport with you. They may make you go through the wand or the pat down, but you can go through. Maybe allocate yourself a few more minutes just in case they stop you. Will HF10 work for you? The answer is I don't know, but since your physician recommended you watch this video, I'm hoping that you give it a try and we have the opportunity to work with you. When patients' lives change before your eyes, it can't be any more rewarding. So if you need anything whatsoever, we're always there to help you, and we look forward to working with you.